Our next guest is here to share his views on the state of the healthcare industry following the targeted killing, we think, of UnitedHealthcare CEO Brian Thompson. We'll also talk about his crusade for early cancer detection and much more. Joining us right now is Bruce Ratner. He is former New York City real estate developer and founder of the Michael D. Ratner Center for Early Detection of Cancer. His latest book that he's been here to talk about with us in the past is Early Detection. In it, he argues for early and more equitable cancer screening. And Bruce, thank you so much for being here today.
Thank you for having me, really.
I want to set the stage just by saying we've been talking this morning about how anger has really broken out after the killing last week of the UnitedHealthcare CEO. There's been stuff on social media and other places, even protesters and demonstrations here in the street where they were dressing up, a look-alike contest to try and look like the shooter, that have been terrible. We don't want to spread any sort of animus and violence that would come from these things. But you are somebody who knows the healthcare system very well. You've written an op-ed that hasn't been published yet, but digs into some of the issues and the frustrations that come out with insurance companies. Why don't you talk a little bit about that? And what you've laid out in this op-ed is that the insurance industry is not winning fans because their denial processes have really ratcheted up. What have you seen?
So the denial process is wretched. And, I used to go when I would speak places and say, we're all in the same boat. We've all had family members who've had cancer and so on. So as I was walking in here, I saw 3 people who happen to be employed here. We're talking. Each one of them has had family denials of claims. And so just as cancer is frequent, denials are frequent. And honestly, when you look at UnitedHealthcare as a company, it has probably more allegations of denial, wrongful denials than almost any other company. And in fact, they have about 1 out of every 7 claims is denied, and only 0.1% of denials gets appealed, because when you look at the appeal process in the Obamacare thing, it's almost impossible to go through. So people wind up either leaving a facility before they should, or somehow mortgaging their home to pay for what the denial was supposed to pay for. It's horrible. The allegations, as I read about more of them, over the last few days, it's just extraordinary. It's got to be reformed. It's not only UnitedHealthcare, it's all the insurance companies. In fact, they use, as you probably know, a computer, AI. They use AI. They bought a company in 2019, UnitedHealthcare did, and that software was originally designed by Cardinal Health for the opposite reason, to try and figure out how long people ought to stay, to how aftercare should be done. When it was bought by UnitedHealth, it was turned into a denial claim, as far as I'm concerned, something to go over claims for denials.
There's a lawsuit that alleges this. There was a separate study by Stat Health that kind of backed up an independent study that backed up some of those claims. I think it's still being adjudicated, but UnitedHealth does have some of the highest denial of service in the industry. I guess the question becomes, what caused this? What got us to this point, and how do you fix it?
Well, I'm sorry, what caused it?
What caused it? What got us to this point with the insurance industry, and how do you fix it?
Okay, so let's talk about what caused it. What caused it is profits. And a lot of the testimony that you've heard already about UnitedHealthcare is that profits before patients. And that's the problem. And you have to, when UnitedHealthcare's claims, and they started allowing more claims, their stock went down 8%. So this is an issue of profits, and they have to keep profits up to keep stock up.
You know that UnitedHealthcare is one of the private insurers that Obamacare uses in exchange of private insurers. When you expand through Obamacare the demand across the board for all insurance products, and the supply stays the same, this is exactly what was to be expected. And I handed you this book. Yeah, I guess you didn't have a chance to read it. But, I mean, there is a case to be made that there's always been a profit incentive for private corporations.
Yes.
To just simply say it's because of profit and it would be solved by removing the profit incentive, it would be even worse without the profit incentive if there was single
I'm not
payer.
suggesting that.
Okay.
What do you think the answer is?
I'm not suggesting the idea that you have a profit center.
The thrust of this editorial is that this can be tied almost singly back to Obamacare.
Yep.
And
So,
the adoption of Obamacare.
So what has to be done? Look, the answer is we have a capitalist system which works very well in many, many ways. In the case of this, obviously, patient denials means more profits. So we can't do very much about that.
We've seen what's happened in the UK with national payer. We know what happens up in Canada when you go to a single payer. Taking away the profit incentive, but taking away the profit incentive doesn't solve things.
I wasn't suggesting that.
Okay, but the demand stays where it is, and if the
so we have to change the rules. So, for example, a denial. It is impossible. Only 0.1% of people who get denied actually go and appeal it. Okay. The appeal process, as I read it, is incredible.
It's
so,
exhausting.
number one, the appeal process has to be made very, very simple.
Let's say you go to not denying anything. We're now spending $2 trillion more per year than we were in 2010.
Look.
So if you go across the board and not deny anything,
nobody's saying that.
But I know, but
you are saying that.
But a government-run entity. If you don't deny it, you just know what you're going to get. You're going to get taxes and subsidies.
I don't think that's what I said.
Okay.
I said that we ought to change the appeal system, number one, to make it very, very simple. The number of documents that you would have to supply for an appeal, why is there only 0.1% appeals? That's because, and it is in Obamacare, the appeal process is incredible. And very, very difficult. So that's number one.
The other issue is a lot of times when you're denied service, they don't tell you why. It's very confusing.
Correct.
You can't figure out why you're sometimes given service, sometimes why you're not. You try and get through the bureaucracy and the red tape on it. It's pretty frustrating. I should point out, UnitedHealthcare is not here to defend themselves, to talk about this. I am sure the company would push back on this. And I will point out that Andrew Whitty, who's the CEO of UnitedHealth Group overall, the larger, broader umbrella group, made some comments over the weekend where he put out a video saying that, in part, we guard against the pressures that exist for unsafe care or for unnecessary care. Now, that got huge pushback online from some of these things.
He didn't expect it to get out, obviously.
Right.
It got out, because those are not the best kind of words to use. But I'll give you an example of what ought to be done. We ought to publish denial rates, and a couple states do that for healthcare companies, so that we can choose, in the capitalist system, we can choose who we want to use for our health care insurance based on denials.
That's not by the state.
So there ought to be something. It should be.
It's all done by the state right now. The question is, do you think there should be federal regulation that controls this? What's the agency that's supposed to do it, and how's it supposed to work?
Okay. It probably would require an act of Congress to do that, to require that, in fact, you have to post or you have to disclose your denial rates.
Right.
It can be done by the states. I don't think it's likely to be done by the Congress, frankly. And so it's got to be done state by state. There are only a couple states that do it. And having been a Consumer Affairs Commissioner and being someone that's in the disclosure world, that's the right way to do it. And it goes back to your system, Joe. It's the correct kind of system. You need something against the other side. And against the other side would be publishing denial rates so that we choose our company based on denial rates, and that makes the companies work very hard to be competitive, just in your capitalist way. So that would be a major, major innovation.